My name is Mark Slaughter, and I'm currently the chair of the Department of Cardiovascular and Thoracic Surgery at the University of Louisville, and also serve as the Thoracic Surgery Program Director. I've been on the editorial board for about 4 years now as an associate editor with the feature articles section. I think for new or young authors who want to submit manuscripts for the Annals of Thoracic Surgery, my best advice is just do it. The hard part is doing the first one, and it's never right, it's never your best work. But hopefully as an editor and the other editors and reviewers, part of our job is actually to give constructive criticism. So the idea is if you just submit the first one, certainly have it reviewed at home and by your peers and colleagues and co-authors, but anticipate that you'll actually get some good suggestions. And from that, you start to learn what makes a good paper. So my initial reaction is just do it and submit it. I think the main reason why many articles actually ultimately don't get accepted is basically originality. And it's harder these days, but the idea is somehow within the article is you need to really hone in on what's new, what's novel, and what is really going to make it an addition to the medical literature. Certainly, I think that is a very common reason for many actually well-written manuscripts ultimately don't get accepted for publication. I think the emerging trends, it's a very exciting time for cardiothoracic surgery. The transcatheter therapies are going to continue to evolve and hopefully will continue to be managed or co-managed by surgeons. There's many exciting things in the treatment of advanced heart failure with new devices and new technology for partial support as well as new total artificial hearts. And certainly I think that there's new evidence that surgical revascularization for coronary artery disease is probably the best therapy in most patients. So I think there's lots of opportunities for new innovative ways to improve graft patency and to further sort of emerge as the primary treatment for coronary artery disease as well. I think we all went into cardiovascular and thoracic surgery because we also like taking care of patients. One of the most rewarding things for me afterwards is just when the family says thanks. When they ultimately go home, they walk out, and you know that you've improved their quality of life and or their long-term survival. It's incredibly rewarding, and the patients are very appreciative. So the one thing that I really would like to do is take a 2-week vacation with my wife. She's sacrificed a lot, and I certainly enjoy what I do. It's not only my profession and my passion, but it's also my hobby. But I say one of these days we're going to take a whole 2 weeks off together, and it'll be fun.